I had no desire to do anything. I got to a point I was totally depressed. And I couldn't see any sense living, coughing continuously,
I didn't want to do stuff because I knew I wasn't gonna be able to breathe, and it was exhausting.
And I got so that I couldn't walk, and I had to go I had canes.
I was low energy. I didn't feel like doing anything. I'd have to struggle.
Actually, truthfully, I thought I was gonna die. I actually thought, this is the end. This is the way I'm going out, I'm not gonna get better. And you almost resign yourself to that.
Bronchiectasis, let's all repeat that. Bronchiectasis, it's a big word. It's a little intimidating. It's a disease that is very much not thought of and underdiagnosed and certainly not treated properly. Right now, there's probably about 500,000 people in the United States that have been diagnosed. If you think that the true number is around 4 million, and we got a long way to go. That is what this is all about, is increasing awareness so we can identify those people so that we can get them appropriate therapy and turn their lives around.
It was also especially difficult for me being surrounded by my animals. I had a St. Bernard, and I was riding horses, and I still do. And when I would laugh too hard, I would have to take at least 3 puffs of inhaler. So if you think about it in like a really complex way, it's like this literally limited your happiness.
The laundromat's right next door. But sometimes I would wait until my daughter came, and she would carry the laundry over and carry it back. I couldn't go out to the restaurant to eat. That's how much I coughed. I couldn't go to the movies because people, look at me. Why are you coughing, And so it ruined your whole life.
My condition was so bad at one time that I sleep on the couch because, in the bedroom, it was just a constant coughing, and I want to keep everybody awake. So last summer, I couldn't walk from the couch to the bathroom. That's how bad it was. I'd be out of breath. I would have to lay down for half an hour to straighten up.
I loved playing golf, and it was a struggle sometimes, to go out and play. I just didn't feel like playing. So I just sat around and read. One of the things my wife likes to say is that she could hear me breathing from another room. It was tough. It was tough. It takes a lot out of you.
It felt like when you go up a hill and you've been running and you can't breathe. Well, that's what I felt like all the time. I get spells of it. I couldn't walk in the stores. The boys had to go help me get my groceries because I couldn't go around the store.
Bronchiectasis can affect any person of any age, any socioeconomic group, with any literacy. I have diagnosed bronchiectasis in 4-year-olds, and I've diagnosed bronchiectasis in 80-year-olds. Normal, healthy lungs, the air passages, the bronchioles, are tubular, and they have finger-like projections lining them called cilia, and coat on the top of those cilia is a very thin layer of liquid fluid, not too thin, not too thick, just right. So when you inhale something that doesn't belong in your lungs, it lands on that blanket of fluid, and the cilia are constantly beating and sweeping and keeping our lungs free of pathogens. Every once in a while, people cough. They don't realize that they're coughing up some of this, and out it comes. So it keeps our lungs healthy. And certain types of pathogens will damage those nice tubular structures and cause them to balloon outward. When these infections damage the lungs, it takes out those cilia. The mucus glands start producing excessive, thick mucus, and you wind up with these pockets of mucus, and it's a great place for bugs to grow. Now, the people with bronchiectasis are not constantly sick, that the bug burden waxes and wanes.
I had 5 or 6, maybe more, bouts of pneumonia, and I was treated. And like I said, I'd have it 1 year, and then I wouldn't have it for 2 or 3 years, and then I'd have it again.
No one ever thinks of bronchiectasis, so they don't diagnose the bronchiectasis, and the patients never get the definitive treatment, and they never get better. So these patients are misdiagnosed with bronchitis, chronic bronchitis, pneumonia. If the patient has COPD, They are constantly misdiagnosed as exacerbations of their COPD.
They thought COPD, maybe. They weren't quite sure.
They told me I had asthma. I also had allergies.
They said I had AFib and heart failure.
He says, well, you've just got COPD. He said, that's, you'll just have to live with it. And that was his attitude.
These are the patients that are in and out, this revolving door. Once you've identified the bronchiectasis and get them effective treatment, you stop that. These people, they stay healthy, they stay out of the hospital. People with bronchiectasis, they're chronically ill, and you get them appropriate therapy, high-frequency chest wall oscillation. Over a matter of weeks to months, they blossom, and you have just changed that person's life forever.
High-frequency oscillation is the way to go, and it works, and it's been shown over and over again to work.
Think about this. Medicare pays for the high-frequency chest wall oscillator. It's an expensive device. In fact, if you look at the average cost for a hospitalization for a COPD patient with exacerbation with an average length of stay, that device just paid for itself, avoiding one hospitalization. Initially, when a patient gets the diagnosis of bronchiectasis and you have to tell them that this is going to be your friend to the end of days, they're not really crazy about that. But once they start using it and they feel so much better, it's their best buddy. Multiple different patients have nicknamed it the thumper, which I think is pretty appropriate. The very first time that they encounter the thumper, they do it in the safety of my office. Many of these patients will produce a significant amount of sputum with that first treatment. You want to collect that sputum and send it for culture.
It's really disgusting. They gave me a cup to spit into because it worked so well that the mucus that has been sitting in my lungs for like years was like coming out of me.
There is no cure for this disease, but with the right equipment and the right relationship between the patient and the provider, we can turn this disease around. This requires devotion, both on the part of the provider and the patient. With a mutual commitment to a common plan with mutually agreed upon responsibility and expectations, we can get the patient to a quality of life that is essentially no different from an individual who does not have bronchiectasis.
Well, if I didn't have that vest, I don't think I'd be here now doing what I can do. Because I can do anything that I could do when I was in my 70s. About 2 years since I've been in the hospital.
I'm 90% of when I was 20 years ago.
I haven't had pneumonia, I haven't had flu. I went through last winter, I don't even think I had a bad cold.
To go from that constant coughing, you can't imagine, to now, if I cough once a day, I'm done. I haven't had an antibiotic since I went to Dr. Seifer, not one.
I'm able to, be focusing on my riding instead of focusing on me being able to breathe throughout my lesson. I feel like a weight has been like lifted, kind of physically almost, and like emotionally, mentally, everything just feels easier to do.
And it's a beautiful therapy because it's purely mechanical, it's not pharmacological, it doesn't interfere with the other medical conditions you're treating. It's something the patient can do at home. And because it works, because the patient feels better, their compliance is through the roof. They want this because they feel it working for them.
If you went into medicine because you want to make a difference, because you want to improve someone's quality of life, this is low-hanging fruit. This is an opportunity for you to really make a huge difference in the lives of your patients.
The downhill trend that I was on, I wasn't suicidal, but it was a chore to live. And that's awful to say, but now it's fun, I enjoy life. Don't we, Pip?